You're listening to a podcast from 702 and Cape Talk.
702
Health and Wellness.
Our focus on our health and wellness feature is pelvic floor and urine incontinence. There's trauma, right, to the pelvic area that may result in pelvic floor damage in both men and women, and it can often be treated according to most urologists. But what holds many people back is the shame of speaking about it. So we've decided today to bring in someone who will answer your questions around pelvic floor dysfunction and incontinence. So if you suffer from holding urine or feces, so I want you to please share those experiences with us. And maybe it comes from trauma. Maybe you've been experiencing this recently and you don't know why it is happening. Please tell us how it's affecting you. And maybe if you need advice from Dr. Colin and ask any question you may have around pelvic floor and urine incontinence. So let's welcome Dr. now, who's a gynecologist and obstetrician. Thank you so much for your time. Welcome to the show.
Good afternoon, Clement. This is Dr. Dakalo Muavha, the Urogynaecologist from Limpopo.
Dr. Muavha, thank you so much for your time. Let's start with the definitions around this. What is the pelvic floor? When we talk about pelvic floor, what are we talking about?
Yes. No, thank you, Clement. And I must just say this, I usually get called in different radio stations. But this time when I said I'm going to 702, the people around me, they were saying, now you're famous, which means, Clement, now it means, Clement, your show and 702 is very popular, And I must tell you, like last night, I was practicing my 702 English, so I didn't sleep.
So you're going to be a so-called 702 black.
Absolutely.
Okay.
So let's go back to your question, Clement. When we talk about pelvic floor, I want you listener at home to think about the bottom of the basket full of fruits, right? That basket with fruit is similar to what the bottom part of a woman or a man is, where in between the pubic bone and the tailbone there is this layer of muscle or a floor of muscle at the bottom. And when we talk about the fruits, in this case, the pelvic organs, which can be a bladder, vagina, a uterus, and the bowel, it's resting in this layer of muscle. And they are just like the bottom of your basket. And they are just at the bottom of it and where these pelvic organs are resting in.
Yeah. What are some of the symptoms, Dr. Muavha? Because sometimes, people who have pelvic floor disorders, they experience different symptoms. I know there are people who may experience pain during sex, pain in the pelvic area. So what are some of the symptoms to look out for?
Yes. So, thanks, Clement, for that beautiful question. So, before we get to the symptoms, maybe let's talk about what are the commonest problems emanating from when there's a problem with this pelvic floor. So, if you think about the same analogy of a basket with a lot of fruits, if there are too much, this basket, the bottom of it can actually sag down or bulge out, or sometimes they can be too heavy that the fruits can fall down. So exactly what happened with the pelvic floor. So if there is weakness of these muscles holding these pelvic organs, such as a bladder or rectum, so there will be a bulge coming out or through the vagina or into the vagina. So a person would experience a herniation or a bulge, or they may sometimes say, I feel a tennis ball inside the vagina. So that will be one of the symptoms. The other thing is that the neck of the bladder, or the pipe which is taking urine from the bladder outside the body, it's also surrounded by this pelvic muscle. So when you sneeze, Clement, and when you cough, or when you are in the gym lifting and waiting for your six-pack, these muscles, they contract so that urine does not leak. So if this muscle now becomes weak, then that's when you realize that the person will now come and present with urinary incontinence, which is the involuntary leaking of urine, and they may also present with infection around there, because if they're always wet in the area there, in the perineum, they may have infection and itchiness. The other thing, as you said, yes, they will present with sexual dysfunction. Okay, because imagine now you are having sexual intercourse with your partner, but there's a tennis ball or the womb is not in the right position. And that can actually cause discomfort. And sometimes this womb, if it's actually totally out, it can be having sores or having lesions around it, and sometimes can be confused with cancer, whereas it's just that the womb is actually hanging out of the vagina. Yeah, so those are some of the things which patients will be presenting with.
Let me remind the listeners that I'm taking calls as well. If you've got questions for Dr. Muavha, you can give us a call on 011-883-0702. If you're struggling with your pelvic floor or urine incontinence, give us a call. If you've got any question regarding that, you can call in and ask Dr. Muavha the questions you may have. I'll also play some of your voice notes coming on 072-702-1702. Can these disorders be treated, Dr. Muavha?
Yes. Funny enough, Clement, these problems can be easily treated. The reason why it hasn't been is because people are so ashamed to come forward with the problem. So they actually suffer in silence. I know in some deep rural areas, women who are unable to control their urine and control their stools, and they actually build a small home on the side of the community, and they say those ones, when she's old like this and urinating on herself, is because she's a witch or because she was bewitched, So, and that becomes a problem because people don't want to come forward, because if they come forward, there's a stigma attached to it. The other thing which does not help is that when they go to the doctors will tell them that, no, mama, it's part of growing up. You must man up or you must woman up, because your grandmother had the same. And you know why doctors are like, some doctors are like that, is because this field of urogynecology is a very, very new field. And most of the doctors are not experienced or trained to deal with this kind of conditions, So that's why you find that because you will go to a doctor who's not experienced, we'll just say that it's part of growing up, and then that discourages people to even talk about it, So some people they don't even talk about it to their doctors. When so that's why people will suffer in silence, whereas the treatment is actually very easy and it can be treated easily from the experience end.
How are people reacting? And by the way, I just want to tell people that you are very experienced in this field, Dr. Muavha, because you're one of the 4 South Africa's new qualified urogynecologists. Which is a field of medicine that aims to assist patients with issues relating to urology and gynecology. And I know that you opened Limpopo's first urogynecology hub in the 2 major private hospitals in Polokwane. Are you seeing people come more and more often? Is that shame being lifted, or is shame still quite a serious factor in those areas?
Yes, Clement. That's correct. Yeah. So what I have done since I started in Polokwane in public hospital or also in private hospital, I've been having this drive in the media, and I have regular shows in other national radio stations as well. So that has actually helped. And previously, with books, they will write and say this problem is usually in Caucasian women and it's not common in black women. And I must tell you, for the past year I have been in Limpopo, I have a long list of patients who we can't even able to operate for now. We give the date up until September. Because now people are aware that these things can be treated, and it's not part of growing up. It's a problem, which, the challenge which I have, more especially in a rural provinces, Clement, is that older women, for example, are the breadwinners. You know, I went to University of Cape Town and University of Pretoria. Actually, I started in University of Pretoria, and the person who paid for me was my grandmother for the transport using a grant, you know. So if that person who actually has made a doctor in me as a grandmother paying for my food and everything, and she cannot control her urine and she cannot control her stools, you see, depression comes. With depression comes with high blood pressure and early death. You know, people die early because of this other, you know. So, and some people will say urogynaecology and this urinary problem cannot kill you. It can, because a person, for example, I'll give an example with person with urinary incontinence, where they have an urge to rush to the bathroom, and then when the urine comes, when they rush to the toilet, they may fall. And when they fall, they have a hip fracture. With hip fracture comes with bedridden. With bedridden comes with complication of clot in the lungs, and that can kill a patient. Coming from what is a treatable thing like a urinary incontinence. You understand? So it has a big financial impact even for the rural economy, because most of the rural economy, to tell you the honest fact, is based on these grants of grandmothers and grants, and you know, and those are the ones which are taking children to school. You know, and those are the people who are neglected, and we say it's not common in black women. It's not common in black women. It is very common. I have a lot of people who are still waiting to be operated in our hospital because now they know that it can be done. It can be operated.
I want to go to the listeners now. They're calling us on 011-883-0702. Let's start in Lombardy East. Rodney, hi.
Hello, good day to you. How are you?
Good, how's it?
Good. Question for your guest. With an overactive bladder, is there an operation that could be performed to stop the constant urination?
Okay, with an overactive bladder. All right, thank you for that question, Rodney. Dr. Muavha?
Yes, Rodney, thank you for the question. Yes, Rodney, just for the listeners to understand what Rodney is talking about, this is when someone has a bladder which is just having its own mind, you know. So when you feel like you need to go to the bathroom, already before you get to the bathroom, the urine just leaks. And the problem there is because the muscle of the bladder is overacting. That's why we call it overactive bladder. And usually it can be caused in males, can be because of the problems with the nerves. You find that a person with diabetes, the nerves going to the bladder muscles is not working well, or a person had a stroke, you know. So all those things can cause overactive bladder. The question from Rodney is that, can it be treated surgically? We start, Rodney, first by giving what we call conservative management, where we teach you how to train your bladder, where you do pelvic floor exercise. If that, Rodney, doesn't work, then we give you some medication, which most of the times they do work, but some of this medication, which are a little bit cheaper, they have a lot of side effects which people don't persist and use it for long. So in the case where you have tried all those things, Rodney, and it's not working, yes, there is a surgical procedure. Sometimes we can just put a Botox injection into the bladder muscle, and that sometimes can be very helpful. The last operation is to put something like a pacemaker, Rodney. We call it a sacral nerve stimulation, which will help in stimulating your nerve so that it can respond to your brain when you are not in a right position to urinate, then it can stop urinating. So there's a wide range of treatment options, Rodney, before we get to the operation.
Okay, yeah. Rodney, thank you so much for that. I hope it's helpful. Let's go to Ondekas Park now. Rueda, good morning.
Good morning. I have a question for the doctor, please.
Sure.
If you've had a hysterectomy and the ovaries have also been removed, could that also cause the pelvic floor to sag? And if that happens, can it also be rectified by an op?
Thank you for that question, Rueda. Dr. Muavha?
Yes, Roida, thank you for the question. That's correct, Roida. When you had an operation where they remove the womb and the ovaries, it puts you at a very high risk of having urinary or pelvic organ prolapse. Why, Roida? Because when we remove the womb, we also remove or we cut the ligaments which is holding the womb together. Okay, the ligaments which will hold, remember our analogy of the basket and the fruits, which is holding the womb together, we cut it off, and that end up resulting in the muscle being weak, right? And the other thing is what you said, when they remove the ovaries, their function is that they give you estrogen, and the estrogen is so important in the fibers of the muscles. So if you don't have enough estrogen, especially in patients who are older in menopause, they are at higher risk of having this weakness of the pelvic floor. So it's true, Roida, that if you had that kind of operation, it poses you to be at risk, adding to the fact that, Roida, you are a woman, and maybe adding to the fact that you also have children and you possibly deliver those children normally, and those all together, they become a higher risk factor. So to complete your answer, Roida, yes, this thing can be treated and can be treated easily. We can start again with non-surgical treatment, which we start with pelvic floor exercise. Sometimes, Roida, with pelvic floor exercise, it doesn't help so much, purely because exercise you have to do it for a longer period of time, and you have to be patient. So if that doesn't work, we also have a pessary, which we can put in and lift everything. But pessary is not permanent. So from surgical point of view, as you ask, yes, there are multiple options for us to operate and fix it. And I must tell you, when we fix it by operation, up to 95% of people with this operation, they actually so happy and don't have any kind of recurrence when we have this operation.
Okay. Doctor, you spoke of the pelvic floor muscle exercises. How do we do those?
Yes. Yeah. The pelvic floor muscle exercise, Clement, are little bit challenging. It's not the same when you go and do your push-ups for your six-pack, Clement, because when you do the push-up for the six-pack, you can see those muscles easily. But the ones we are talking about is those pelvic floor muscles, which is not so easy to be able to touch or see. As a result, you need to have some guidance we have the physiotherapists who are trained to train people on how to exercise in this muscle. But the one thing you could do, for example, when you are sitting at home, Roida, as we speak, is that you can do like you are squeezing the urethra or the muscles there, just like when you don't want to go and pee. You just squeeze those muscles. I'm doing it now as well. So the listener at home, just try to do it with me. So you squeeze like you are you don't want to allow yourself to pee, right? And then you can do that for 10 seconds, for 10 times, and you do it 3 times in a day. And you can do it while you're sitting there and broadcasting to us. So that's the beauty of it. You don't need to actually go to a gym to do that. You can do it with you. But it's as like any other exercise, you have to be patient by it, and the results can come after 3 to 6 weeks. So you have to wait. Unlike the surgery, which when we operate you today, already on the same day you have the results. I'll give you a funny example, Clement. After our operations, we will usually get flowers. Immediately, a day after the operation, I get flowers from the patient. And she said, "Doctor, I'm so happy, I'm feeling better." But in 6 weeks' time, I get another flower, and I tell her, "But you gave me the flowers already." And the patient will say, "No, it's actually coming from my husband." Because husbands usually want to wait and test drive, So that's yeah. So surgery will have a immediate response, but with exercise it takes a little bit longer.
Yeah, and the benefits can be long term as well.
Yes.
Here's a message I'm getting here. Someone says, "Okay, great information from the doctor. May you kindly advise that everyone suffering from pelvic floor conditions can they attend physiotherapy treatment? This condition has been handled by physiotherapists for the longest time. While it's not common among GPs, physiotherapists have got extensive experience in this."
Yes. So it's a good question. Yeah, as you said, that most of the general practitioners, but now we are changing that because we do workshops for these general practitioners so that they are as passionate as we are with this problem, because it affects people's lives. This is a social dwarfing problem. A CEO, I have a CEO who comes and say, I can't do my work because every 3 or 5 minutes I have to rush to the toilet. So it's correct that most of the general practitioners, they don't even ask about those questions. If they don't ask, patients feel like it's not a problem because the doctor didn't even ask about it. So it's correct that GPs usually don't recognize this problem. But even with physiotherapists, there are those who are trained for pelvic floor disorders. So if you walk to any physiotherapist, some of them may not even be trained, because with this kind of challenge, you have to have some form of training. Yeah,
and we've got even a message here from someone who says, I'm a pelvic floor physio and I see great results with physical rehab of the pelvic floor. Surgery is not the only option. Dr. Dakalo Muavha, I have to thank you. We're out of time. Thank you so much for guiding us through this discussion and for taking questions from our listeners. Dr. Muavha is a urogynecologist.